Physiotherapy, massage, chiropractor. All these are things that we hear about very frequently, and many people have use for. They use them in a way just to relax in a recreational manner. Some use them as a real treatment for some illnesses they might have or some stiff muscles or joint problems. So what is the difference between massage therapist, chiropractor, a physiotherapist, and what are the different uses of each one of these? And how can this affect our well-being? Not only our physical well-being, but also what is the effect of massage, physiotherapy, chiropractor? How can they affect our psychological well-being too? To talk in more detail about this, I'm really delighted to be accompanied in the studio tonight by David Oldnall, who is a massage therapist. David, welcome to the program.
Thank you very much.
And thank you for being with us. So, just at the very beginning, can you shed light on the differences between a massage therapist or like massage therapy in general, physiotherapy, chiropractor? Like, what is the difference between each and every one of these?
I can speak mostly to the physiotherapy and massage therapy. That's my greatest experience.
Okay.
I myself have been a massage therapist for 27 years plus, and massage therapy is manipulation mostly of the soft tissues of the body, the muscles, tendons, ligaments, to some extent the joints. Physiotherapy, they deal with similar subjects, similar problems, but they have a different skill set. They have more tools in their toolbox. They can use various modalities as well as manual manipulation. And modalities would be things like ultrasound, interferential, or in the case of the clinic where I work, mostly photobiomodulation, which everyone just prefers to call laser therapy because it rolls off the tongue much more easily. And chiropractic, I'm hesitant to speak too much to chiropractic because I haven't really worked closely with chiropractors, but they are more manipulation and dealing with the structural or the spine of the body, dealing with very often what are called subluxations, which is it could be like a rotation or slight displacement of the vertebra or the bones of the spine. But they do work with other tissues, not just the spine. Chiropractors have a pretty big bag of tools as well. And more chiropractors are getting into modalities as well, much to my chagrin sometimes.
Okay. So, like, before we started our live show now, I was just asking you, what is the difference between a masseuse or a masseur and a massage therapist? Is there any real difference between the two terms?
Well, to be a massage therapist, at least in the province of Ontario, you have to have completed the program and passed your provincial board exams. So you are a licensed therapist. Truth be told, anyone could just say, I'm a masseur.
Okay.
You could throw a shingle out on your porch and say, hey, I'm a masseur here. But to be a massage therapist, you actually have to have attended an accredited program and then gone on to write your provincial board exams. And then you have to maintain that registration through their quality assurance program, which means continued education and other programs just to guarantee that you can actually keep your license.
So you need to be certified, and what I can understand from you, it's a regulated job.
Yes, it is, very much so.
To be a massage therapist, but not a masseur and not like a masseuse. Like a masseur and masseuse can be open to anyone who would like to offer massage.
Pretty much. But I would say all registered massage therapists could be called masseurs, but you would have to be a registered massage therapist to be licensed to be able to work with extended healthcare benefits programs or to work with motor vehicle accident claims, things like that. You do have to be a registered therapist. And all registered massage therapists, physiotherapists, chiropractors are all under the Regulated Health Professions Act.
Okay.
That's the legislation that covers us all in the province of Ontario.
And actually, we have a first question here from one of our viewers. Raya, she's saying, for back pain, you go to a physiotherapist or a chiropractor?
My preference as a massage therapist, I always go to a massage therapist first. It depends on what's the cause of your pain. If you
Like lower back pain, which is the most common one.
Yeah, if it's muscle pain or an imbalance, a chiropractor might be extremely helpful. Depending on the severity, if you've been in an accident and perhaps you're dealing with disc damage, perhaps quick manipulations would not be the best option for you. That's when you'd be better off to go with something a little more gentle, either massage therapy. But even I don't like massage if people are in too acute of pain. I think physiotherapy, they have a pretty big bag of tricks that they can use to treat people.
Okay.
Even in acute pain, you can go in and be treated safely.
So you think chiropractic would give you a more swift solution, but not a very thorough, not a very again, we're speaking in a very objective manner here as much as possible. We're not against any chiropractors, we're not against any physiotherapists or any masseurs, masseuses at all, but to the best of your knowledge, would you say that going to a chiropractor is like a faster solution, but not a very profound one, not a very thorough one?
No, sometimes chiropractors can be the trick, and people go in and they'll do their manipulations. They'll reduce subluxations, and people can get very immediate and sometimes very long-lasting relief. But again, I don't want to say anything disparaging because I myself have had some chiropractic manipulations in the past that have been spectacular. When I was still a student, one of my professors was a chiropractor, and he helped me deal with a few situations where I had done some kind of foolish things and injured myself. And in quite short order, he took care of my problems, and they have not been recurring since.
So who should I resort to first, usually for a back injury? If I have a problem in one of my joints, like elbow joint, knee joint, the most common, problems that people have, or neck, moving your neck, or some people have problems sleeping, for instance. Who should I resort to first, like a physiotherapist or a chiropractor?
Well, after seeing your family physician first, just make sure that there's a record of it, and see if there's anything that they can do for you first. I would have to give the definite answer of it depends. The physiotherapist I've worked with over the years, and I've worked with a lot. I've worked in multiple environments, including a hospital setting. And very often they have a great set of diagnostic tools. They're really good at assessing patients and determining what is the appropriate course of action. And if it's something like a tendinitis, I really believe a physiotherapist would be your best bet. To treat some sort of inflammatory soft tissue conditions, I think a physiotherapist is your best bet.
Okay, so it depends on the diagnosis first.
Yes.
It needs to be properly diagnosed, and then based on this diagnosis, we can take the next step.
Yeah, but even if you go to your family doctor and your family doctor says, "Oh, I think it's this," and they write a prescription and they suggest you go for therapy, the physiotherapist will do a thorough assessment when you come in. They have to, because you can't treat people without knowing exactly what you're dealing with. And very often we'll find that the doctors were very, very close, but maybe not quite bang on. And it turns out that maybe the problem that the doctor was thinking they needed to come in for is really secondary to another problem that might have precipitated the second problem.
Okay, something related to what we were saying again. Raya's back again, and she's saying, I went to a chiropractor for my back pain, but caused me more pain. He told me it's normal. I didn't feel it was normal. My question, is it normal, as he said? if you can answer this question.
Well, I don't know what he did, and I don't know exactly what her problem was. I can tell you this from my own experience, even with massage therapy and physiotherapy, depending on the modality. Sometimes as you're working on people, you have to push through part of the healing process. And part of the healing process is an inflammatory response. So if you're doing an assessment, you have to try to reproduce the pain to try to figure out what it is you're treating, which can cause a little bit of aggravation. The clinic where I work as well, we do a lot with, I mentioned laser therapy, and one of the things that laser therapy can cause in the first 1 or 2 sessions is a very mild inflammatory bump. So I tell patients it's not unusual at all for you to feel a little bit of discomfort that night or the next day. It's not the desired response.
Okay.
But the thing that I can tell them is it's the good news, bad news. The bad news is you're having some discomfort. The good news is you responded to the treatment. It's just you're having a slight inflammatory bump.
Okay.
But sometimes people will feel nothing, and sometimes people will feel better. Everyone is a little bit different. And with regards to Raya's concerns here, I don't know. Again, I'm uncomfortable commenting too much on chiropractic. I would never say it's normal to be worse, but at the same time, it's not incredibly unusual.
Okay. Now, for people who are playing sports, like, usually in sports games you have physiotherapists, like, usually as part of the team.
Yes.
Not a chiropractic.
Not so often, no.
Yeah.
And again, I think it's because very often athletes, the problems are more soft tissue in nature. And again, the physios have those tools. They have the multiple modalities. Plus, they have their ability to do manual manipulations. Their ability to do assessments is really quite top notch. But what chiropractors would be as well.
Okay. Yeah.
I think that for that particular application, and usually sports injuries very often are strains or overtraining, I think physiotherapy would more likely be the better option on a regular basis. Chiropractic, I think, is more, back pain definitely, but I know a lot of chiropractors now are branching out and they're doing a ton of other things. My preference would be that they try to focus on their primary, core skill set, which I believe is manipulation and trying to make sure that the spine is properly aligned.
Okay.
And maybe stay a little bit more within their scope of practice as opposed to bleeding out into everyone else's scope of practice. I'm always a little leery because there's a lot of clinics now that they offer chiropractic and physio and massage and will sell you your supplements and will do personal training and will fit you with orthotics. And I always worry if you're selling everything, what are you best at?
Okay, yeah. So, like, it's just an open shop, like, and it's a very comprehensive, apparently a very comprehensive coverage of everything. But in reality, like, they are like, there's a man of all trades, but you're not really of any.
Master of none.
Exactly.
And I'm not saying clinics can't have multiple practitioners and offer all of those, treatments and all of those options to their clients. I just think that there should be more than one person working there if you're offering a dozen different services.
Okay.
I go back to my own experience, and we offer a few core services. We try to focus on those. A lot of people have asked me, why don't you sell braces? Why don't you sell this? Why don't you sell that? And it's, I first of all, I feel it's a little too self-serving when you're selling things. And I have to worry is, am I still always going to have my client's best interest at heart, or am I starting to worry more about how much I can push out the door? Because,
I understand. Another thing that they might be offering, like Raya's back to us again, she's with us, and she's saying, what about acupuncture? Like,
I am a big fan of acupuncture. My first experience with it was tremendous. After years of being incredibly resistant to acupuncture, I worked with a therapist who he'd been doing acupuncture for years. And I myself have some chronic back injuries. And this gentleman would say, when he saw me limping or a little bent over, he'd say, "Why don't we try a little bit of acupuncture?" And I would kindly say, no, thank you, that's okay. But in my mind, I was thinking, you're not sticking needles in me. And one day it was just flared up so horribly, and he offered, and I thought, okay, fine. And in my mind, I'm thinking, when it fails, you'll stop bothering me. Okay. And he did the treatment. He only put 5 needles in my low back and my hip. And I was really very pleasantly surprised because my pain was reduced by almost half.
Wow.
Now, that's not gone, but when your pain level is like up to almost like an 8 out of 10, you're almost non-functional.
Of course,
4 out of 10 is not nice. No one wants that, but I can function with a 4. I cannot function when I'm suffering an 8. So I tried the acupuncture. I was thrilled with it. I continue to go more regularly, and it's one of my 3 favorite things now when my own back flares up. I think I'm a big fan of acupuncture. I would just suggest try to find someone who's trained and has experience, because there's an awful lot of acupuncture programs being offered right now, and I worry how many people are getting there, and I just think if you're going to be an acupuncturist, that should be your core skill set. I don't think it should be one of the 10 things
and
that
is
you
this
offer.
a regulated job too? Is there a board that governs this?
I don't know that there's specifically a board, but I do know that there are some approved programs within the province of Ontario, and I do know that you can get licensed for acupuncture in Ontario. But it's very, very specific programs you'd have to take in order to do that.
And some people are confused about acupuncture. Is it really a treatment, or is it just a painkiller? Like, is it sort of a induced sort of tranquilizer, a very strong one, so you just block, the path of energy from one place to another, electricity from one place to another? Is it a real treatment, like a long-lasting one, or is it just like a long-lasting tranquilizer?
My experience is it's been incredible for pain relief. If you have a structural problem, sticking a needle in you is not going to fix the structural problem. But there are times when you're in a great deal of pain, that's all you care about.
Yeah.
If you can relieve me of my pain, I don't care if I'm not going to be 100%, but if you can relieve me of my pain so I can function, so I can actually take part and participate in my own life again, that's pretty remarkable. And that's what I found for myself. Acupuncture, when I flare up really bad, acupuncture has worked really well for me in the past. When I'm in between, when I'm feeling pretty good as a form of maintenance, my favorite thing for maintenance is a little bit of exercise and massage therapy is maintenance. But when it flares up, acupuncture is one of the things I find is extremely helpful for pain relief.
A very common question many people might ask is, how frequently do I need massage? Is it just a recreational thing, just to relax? So, like, if I'm feeling well, if I'm okay, then probably I do not need massage, or like, to what extent does massage really affect your well-being?
That depends. I joke. My clients will ask me this: how often should I come in for massage? And I tell them if I want my debts paid off 3 times a week for the rest of your life. But realistically, there's a whole bunch of things that you have to look at. Ideally, if money is not an option or someone has fantastic benefits, I would say if you don't have a major problem, about once every 4 to 6 weeks, just as a form of maintenance. It is relaxing. There's nothing wrong with something being relaxing. There's nothing wrong with feeling good. But massage also helps to promote circulation, just relaxation, reduces small knots. It can help you identify postural problems that you might not even know. And very often people go for massage and say, wow, I didn't even know I was sore there. And I always say, well, I didn't do it. But okay, why are you sore there? Now we've identified that you've got a small imbalance or a small problem there. What is it what's causing this? So now we get to play detective and try to figure out, is this something with regards to your work posture? Are your kids rotten and they're stressing you out? Do you sit down at night and watch TV curled up on the couch with your head all cranked up on a pillow? But to get back to your question, it's about once every 4 to 6 weeks I suggest for people. That tends to be kind of a realistic something that they can actually keep up on going. It's not too much of a financial burden, especially if you have extended healthcare benefits, and it's good for you. There's massage is just, it's a good thing, and I wish more people would go.
Okay.
Just to take care of themselves, even if there's not a major problem. It's good for you. And stress, which is a killer, manifests physically, and massage can help deal with those physical manifestations.
So people find a lot of shops now again that are specialized in something like foot massage. So is this like a different field, different branch of massage? Is it like, or any masseur masseuse can also do foot massage?
Anyone can do foot massage. If you're looking for very, very specific work they're not a regulated profession, but reflexologists are. It feels wonderful to have the feet done. Now, again, I'm not an expert on the field. I took a course on it, so I have a cursory understanding of it. But the idea is that in the soles of your feet are incredibly rich in nerve endings, just like your hands, your face, your feet, very, very rich in nerve endings. And I guess the philosophy behind reflexology is that by working the incredible rich nerve endings of the feet that share tracks all the way up your spine, up to your brain, you can actually have an impact on the other parts of the body.
Wow. So would the same thing work with palms of hands again? Like
Yeah,
your hands?
there is actually hand reflexology as well. That I'm not familiar with. But with regards to foot reflexology, that just feels absolutely spectacular.
Okay.
I have a lot of people ask me if I do it, and I tell them, look, I have some training, and I can do some really great foot massage. It'll feel good. But if you really want specifically reflexology and specializing in just the feet, you really need to see a reflexologist, someone who works on feet, and that's all they do. And
Okay.
it's the way I feel with any of the specialties. If you need something specific,
So it is a
go
specialty.
to the right person. It is, yeah.
It is a specialty.
And there's a lot of registered massage therapists take it, and now it's absorbed and it's within our umbrella of care. And if someone comes in and they want reflexology by a registered massage therapist, we can now bill that under their extended healthcare benefits, and it's all good. Reflexologists are not regulated, so they're not recognized, so you would not be able to go to a reflexologist and use your extended healthcare benefits. I wouldn't say don't go, but you're not going to get your money back.
Okay, I understand. And so we have many different kinds of massage now.
Yes.
So, like, can you shed some light on, like, which kind of massage or what kind of massage would be more proper? So, like, deep tissue massage, Swedish massage, like, etc. Like, which kind of massage would be more suitable or the most suitable for somebody who, like, just wants to relax, somebody who's playing a lot of sports, somebody who's had a tough day, like.
I would honestly say, because, again, all registered massage therapists are taught Swedish massage therapy. And the only reason it's called Swedish massage therapy is because the man that standardized it and wrote the textbook, a little bit of trivia, his name was Per Henrik Ling, and he was Swedish.
Okay.
So his book initially was called The Swedish Method, and it was adopted basically around the world, anywhere where massage is regulated. And that's why it's called Swedish massage therapy and nothing more. It's the techniques come from all around the world. It's been around thousands of years. There's glyphs from China and India of massage techniques in Egypt, and they've just all been sort of taken, put together, standardized. So all registered massage therapists are taught Swedish massage techniques, and then everything else falls within that scope. So if you want to do deep tissue, active release, those are within that scope as well. There's all kinds of techniques. There's all kinds of extra things you can go to train, but really, Swedish massage therapy is what all registered therapists are taught, and then everything else is just kind of toppings on the sundae.
Okay.
But you were talking about if someone, what would be the best overall? I'd say Swedish massage. If you're an athlete, generally athletes have slightly more resting tone, so they need deeper work.
Deep tissue massage.
They need
usually
deeper work. I actually had the good fortune way back in 2001 of working with our national flatwater paddling teams. So these were Olympic and world-class kayakers and canoers. And it was an incredible experience. I got to go to their training camp down in Florida, and then I got to go to the World Cup races in France and Germany. And I worked like a dog when I was there. And they asked me the next year if I wanted to come back, and I actually just politely declined. Not because I didn't like it. I loved working with the athletes. And when I was there, I gave 100%. But when I got home, I was exhausted because they just do. They need very aggressive work, and they need it regularly because their bodies are sports cars compared to the average person.
Of course. So, so deep tissue massage, like some people do it with their hands, others do it with feet. So which one is like, is there any preference to it? Is there like, some people might ask this question, is there an erotic version of it?
I don't know about that, but I'll say that I'm 260 plus pounds, so I don't use my feet to massage anybody. I think I'd probably kill them. Most of the time for deep massage, it's hands, forearms, elbows. Is there an erotic method or a component? No, not if you're a regulated professional. I have had clients over the years ask me questions about it. You're touching people. You must have some nice looking people, and I know it's hard to believe, but to me, because I've been doing it for 27 years and it's work. To me, it's like working on a car or laying bricks. There's absolutely nothing sort of sensual about massage from my point of view. Perhaps the person receiving it might feel it, but to me, it's just work on another body. Yeah. And I've worked on bodies of every size and shape and color and texture, and I've worked on complete bodies. I've worked on people with deformities and amputations, and in reality, a body is a body. I always do my best to try to treat every single person the same way. I try to give them the same amount of sort of respect and attention that I would want to get if I was to go somewhere.
Yeah, because there's always this fine line or like gray area that because massage again is sort of advertised as an erotic tool. Again, it is there as well. So that's where the confusion might arise.
They are not registered therapists. I can tell you that. It's been a bit of I think most registered therapists, it's a bit of a bane of our existence that they're even allowed to call it massage. It's tough because there's a lot of people out there that don't know. And pardon me, I'm not trying to be crude, but there's a lot of people when they hear massage, they think of topless women giving happy endings.
Exactly.
Which I just don't participate in that. I don't do it, never been for it. Whatever, if it makes you happy, that's fine. But it's really, really hard when you're in a profession that is, as far as regulated health professions go, we seem to be kind of low on the respect scale. And then we have to, compete with that. It just doesn't make it easy sometimes. But again,
So you wouldn't really call them people who like massage,
if you want to call
masseurs or masseuses at all. They're just using the term in an improper way or out of context. Really.
Yeah, and if you want to call them release therapists or recreational
whatever,
something else, I'm okay with that. I wish they couldn't call themselves massage therapists. I think our college and the government are trying to put an end to that, but I don't see it happening while I'm practicing. I think it's going to be a problem for as long as I'm practicing.
And to what extent, another question for Mariah again, does massage help with arthritis, which is something a lot of people suffer from? Yeah.
Now, again, it depends. And I'm not trying to be evasive here, honestly. It depends on the severity of the arthritis. If, say, we're talking about a knee joint and the knees you've got bone on bone grinding. Massage might help to alleviate a little bit of the pain and a little bit of the inflammation, but that arthritis, that's there.
Okay.
If it's mild arthritis, Massage can help relieve some of the associated pain and muscle spasm that happens, because when people have pain, very natural reaction of the body is the muscles try to protect the area, so they tighten up. They have a tendency to over tighten as well. You get inflammation in those joints. So massage therapy can actually be very helpful for alleviating that secondary muscle tension, the pain, and the inflammation. But at the core of it, we can't do anything for the actual joint surface.
Okay.
But if the joints are really tight, being held really tightly together because the muscles are tight, and you get some massage and you alleviate that pressure on the inflammation, the joint will not be as compressed. So possibly we can help alleviate it and reduce the ongoing pain. But really, arthritis is something that's it's more symptomatic relief that we can provide.
You know, there are a lot of, drugs out there that say that they would rebuild your joint. And like knee joints is one of the very common, complaints for people with arthritis, and especially with age as well. So would you say that massage would be some form of a complementary or even a supplementary
I think
treatment?
I think it would be a complementary treatment for people with arthritis. And let's be honest, everyone pretty much over about the age of 20 is already starting to get arthritis. They may be asymptomatic, but we're just big machines, living machines with moving parts,
It's
and
wear and
moving
tear,
parts
right?
wear out. Yeah, they just wear out.
Natural wear and tear.
We get a lot of clients that they'll go to their doctor, they'll have pain somewhere, and they'll get an x-ray, and they come in with their x-ray report, and they've unfortunately read it first. And they come in and they're all upset, say, my x-ray report says I have osteoarthritis, and they found degenerative disc disease. I've got a disease. And you have to explain to them that simply the presence of arthritis or the presence of degenerative disc disease is not the main concern. It's, are you symptomatic, and is it present? Because there are people who can actually have quite moderate arthritis and are clueless that it's even there. And then there are people who have it very, very mild but experience severe pain. So again, the actual presence of it isn't the concern. It's how symptomatic people are. And a lot of that can be helped with, just their overall health, being healthier and letting your muscles take on the pressure as opposed to your joints. But unfortunately, a common mistake is people start to feel pain, so they stop moving. And then their pain gets worse. And they say, I don't understand. I'm not doing anything. Why am I getting worse? I said, well, you're getting worse because you're not doing anything.
And to what extent does massage help if somebody is paralyzed? So would it, like if they're being treated, would it help at all if somebody is paralyzed or somebody's feeling numb? Like they have numbness in one of your limbs or something like that. Would massage help?
Yes, and I'm going to tell you a story. I worked with a client. Obviously, I can't say names, but this poor woman had a brainstem stroke when she was quite young and was completely paralyzed. She could move her face and her lips, so she could sort of speak, but she can't generate sound. But she could feel everything. She had full sensation on her body. Now, just imagine you are 24 hours a day there, and you can feel everything, but you can't move, and movement is key to your circulation.
So she had a problem with her motor nerves, not her sensory nerves.
Yeah. So I would go, for years I went to see her, and I would do everything I could to just do some work on her feet, on her legs, on her arms, on her shoulders. And the amazing thing was, I'm not going to make this woman walk. That was never the intention of the treatment. But her limbs just felt dead and heavy and cold. And it was amazing because after a few sessions, her feet went from just being absolutely ice cold and white to eventually just having more pink in them because it was just regular work that was being done. Our body, especially our venous system, relies very heavily on the contraction of muscles to return blood to the heart. Like our heart pumps and our arteries pump to our extremities. Even our arteries actually have walls that can contract.
Yeah.
So they can send the blood to the extremities. But your body relies on muscle contraction and blood pressure to return the blood back to the heart. So if the muscles aren't working, your heart has to pump the blood to the extremities and it has to pump it back. And as a result, sometimes people can suffer from edema, swelling, puffiness in the limbs. And massage therapy can actually be really beneficial for people who suffer from edema and have that type of swelling.
And something like a frostbite, a massage can help in that as well?
I don't think so. I think once the damage is done, usually the tissue is dead. It's necrotic. There's not much you can do to save dead tissue.
What if you're in the beginning? Because there's first degree, second, third, and fourth degrees of, like frostbites. But like if you're just starting to feel a little bit waxy, if your skin starts to feel a little bit waxy, but it's not dead yet,
then yeah, once you get the body back up to temperature, massage would be a great thing.
okay.
But yet you have to worry: is there going to be a little bit of internal damage to the fine blood vessels in the fingers? And if that's the case, massage can help. But once that damage is done, it's done. It's unfortunately people could potentially suffer just numbness, tingling, just cold. Lack of circulation could be the rest of their life after suffering something like that.
How about gangrenes? Like, would it help at all? Because some people say that, like before going for an amputation, maybe massage can restore something?
I honestly wouldn't say massage, but here's where I'm going to jump into sales mode. Talk about what the clinic where I work.
Okay.
We offer low intensity laser therapy, which is a form of light that the body can absorb, and it promotes actually healing and regeneration. It's basically supplying the body and causing a physiological response. Now, the relevance of that is if someone has like a diabetic ulcer or poor circulation in their feet, potentially leading to gangrene, potentially leading to an amputation, why wouldn't you try a few sessions of massage therapy? It's a lot, or sorry, laser therapy. It's a lot cheaper to go for a few sessions of laser therapy and potentially increase the circulation and save the tissue, as opposed to the cost and rehab afterwards of potentially amputating toes or even a whole foot.
Yeah, amputation, you're losing part of your body for good.
Yeah,
and
it's tens, if not hundreds of thousands of dollars if someone, by the time they get a prosthetic and learn how to walk again afterwards, versus it could be hundreds of dollars in laser therapy to get it. But the problem is there's just a lot of people just still don't understand what laser therapy is. I have people who will call the clinic still asking if we do hair removal, and it's like, no. Yes, laser is used for hair removal. That's not what we do at the clinic. There's just a whole bunch of applications for laser therapy, and hair removal is one. It's used in cosmetic dentistry. Surgeons use class 4 lasers to cut performing surgeries.
Yeah, it's used for eyes. It's used for everything.
Absolutely.
Yeah.
And class 3B lasers can be used to help a great deal with circulation, as well as all kinds of other problems. Muscle problems, aches, pain, strains, back pain, neck pain.
But if somebody's suffering from gangrene, or there is a possibility they might, have part of their body amputated, then massage or laser therapy, that is, that might be an option for them.
I think that would be their best option at that point.
Okay.
It's surprisingly good for wound care, but again, the problem is for these machines to do a proper actual case study, it costs a lot of money and a lot of time for them to do this, to get approval from Health Canada. And a lot of the manufacturers are just not going to push it because the return on investment for them is just going to take too long.
Yeah.
But there are a lot of studies and more and more all the time are being published on the positive things that low intensity laser therapy can do. And I'll still have clients come in every now and then. They'll say, well, I read an article that said that laser therapy, it doesn't work on such and such. And I'll tell them, I said, well, I don't know the article you're referring to. And that article might be absolutely 100% true. Based on the protocols that they used in the testing and the study they did, perhaps it didn't work. But what were the parameters? What was the protocol? Because I could say right here today that I've done an unofficial study and I have conclusively proven that baby aspirin is completely ineffective at treating pain.
Yeah.
And they'll say, well, how can you say that? I said, well, I saw a bunch of NFL linemen over 300 pounds plus, and I gave them a baby aspirin, and it didn't help with their pain. So obviously it doesn't work for pain. It's like, well, it's a ridiculous comparison.
Of course.
Obviously they would need more than a baby aspirin, but that's the problem. People will make an assumption that because, well, this study showed that laser therapy didn't work, well, what spectrum of light did they use? How long was it in position? What was the depth of penetration? Because there's factors that are going to affect the efficacy of that as well.
Yeah, there's some parameters that you must, like, for instance, if you want to, test the effect of heat on two kinds of liquid, then you should keep the pressure stable for both. Yeah, you should just change one thing. But, like, if you're changing everything for both situations, you can't compare them.
Yeah. And how do you know then afterwards?
Yeah.
So again, when clients come in to see us, we usually have a multi-step approach. It's the first time they come in, if they're a candidate for laser therapy, they'll come in, the physiotherapist will assess them, she'll deem what is the appropriate prescription, and then we'll apply it. And we see what the response is. Did they feel good? Did they feel bad? Better? Worse? How much? The next time we'll do that, and then maybe afterwards we'll also put a hot pack on just to keep the blood flowing, keep the area nice and warm for a little while, to try to maximize the potential positive metabolic results of the laser therapy. And then we'll add maybe a little bit of just gentle hands-on, a little bit of massage for 7 to 10 minutes afterwards as well. And then we introduce the bad stuff, which is the exercise at the end that no one wants to do, but I always tell them that it's really crucial. It's very important. They love the laser, they love the massage, they hate the exercise, but it's a very important part of their getting better.
What kind of exercise, like, is it?
Well, it depends. Very often it's just simple stretching and mobility exercises. Oftentimes with shoulders, we'll give them just some very light dumbbell exercises, or we'll cut them some TheraBand, so they can do some basic stretching, strengthening. We have a cable pulley system at the clinic. So it's just a matter of getting people the things, because getting the pain away first is great. Getting a person back to function is better.
Yeah, definitely. Yeah. So pain, of course, is usually the first thing on the list.
Yes.
But yeah, eventually, like, the end result should be back to normal, back to business. You should be able to function as usual.
Yeah.
Yeah.
And that, again, that's who you go to see is going to determine what's most appropriate. You had asked about a couple other professions, and there's another profession I haven't really touched on, which is osteopathy. And I'm associated with another osteopath right now, and I really like her, but osteopathy is very, very holistic, meaning you go in for a shoulder problem, they're going to ask you about everything. They want to fix your entire body. They want to fix everything all, when you leave, you're going to be 100% everywhere. Whereas a lot of the other professions, truth be told, our goal is you come in with a shoulder problem. Well, let's fix that shoulder and get you back to work.
Okay, so osteopathy, is that a regulated job?
It's not in Ontario. There's several schools, and this is my concern with osteopathy in the province of Ontario right now is there's not a standard. There's not an across-the-board standard. Schools all teach good things, but their programs are not the same. Massage therapy, there is a standardized curriculum, there's a standardized program. No matter which college you go to, you have to write that program, you have to pass that program, then you write your comprehensive exams, you write your provincial board exams, and if you pass, you get licensed.
So an osteopathist is he or she like a masseur, physiotherapist, chiropractor? Combination of all, like what?
I would say they're closest to a chiropractor in that they do a lot of work with exercise and manipulation of the body and stretching of the body. I would say I would compare them most to a chiropractor, but they're also very different, the two. Like I'm sure that there's some chiropractors out there screaming at the screen right now, or osteopaths not happy I'm saying that. But I would say of the professions or alternative professions, if you want to call them that, out there regarding healthcare, I would think that they're the two closest to being aligned.
And is there a better time to go for massage, like in terms of seasons? Like we should have more during the summertime, during wintertime? No, like, should be like mornings, evenings, like any preference in terms of time?
I think a lot of people prefer to go for massage after work, simply because once you've had a massage, generally you don't feel like hopping off the table and going right back to work. You usually want to relax. I used to have a lot of clients. There was a large insurance office near the clinic, and we had a lot of people from the departments came in, and they all said the same things afterwards, like, "Oh, I got to go back I still have another 3 hours to go." So I think preferential wise, I think after work or after activity, but truth be told, physiologically, there's not really a big difference as to when. You're not going to get necessarily more of a therapeutic benefit. I do have clients they'll come in for a massage and they'll say, I want to go to the gym and work out afterwards. Is that okay? And I say, of course it's okay. As a matter of fact, it's a great idea, but just please be careful, because sometimes after a massage, people can be slightly more susceptible to a stretching injury. You're just a little more relaxed. You might just extend a little bit further than you might if you hadn't had a massage right before.
But would you prefer to do it the other way around? Like after a workout, you'd come for a massage?
That would certainly be my own preference, and I think most people, that would be what I would suggest. But if your schedule is just not going to allow that, you come whenever. And I'm happy to see people any time of day. Okay. Morning, evening, afternoon, Saturdays. To me, I don't care.
Again, does massage have any effect on sexual activity? Like
I'm going to have to get back to you on that.
Inducing that, promoting that, like...
I think that it would be a good thing in relaxing people. I think
circulation, like again.
Circulation is a big problem. I would think if you're in pain, you're certainly not going to be feeling all that amorous. So perhaps having a massage, feeling better, having that endorphin release, improving your circulation. I can't make any promises to anyone if they come for a massage how they're going to perform afterwards, but I would think that it might be a little bit easier afterwards. But that's not a lot of research on that, truth be told.
Yeah.
And I don't know if I want to be the person to do that research. So.
And how about weight loss? Any relationship there?
Oh God, I wish that was true. I'd massage my own belly away. No, a lot of people have asked, can massage help with things like cellulite? And studies have shown that to a very, very small degree, yes, it can. But if massage could get rid of cellulite, I would have retired a millionaire already. I would have focused on that. What I could suggest to people, if they want to try something, there's a technique called cupping in Chinese medicine, and now a lot of people are getting into it, and they're using the silicone cups. So you can squeeze on, and you can get them on Amazon, not very expensive. You could always put a little lotion or oil on the cup and go over in an area where there's a little bit of cellulite, and the reason cupping can work is it draws the tissue up, and it can help separate the layers of the fascia. And so there's the possibility that cupping might help a little bit with cellulite, but it's not going to get rid of it all. Okay,
and last but not least, how would massage affect your psychological well-being and your mental well-being?
Well, traumas, physical and emotional, can manifest themselves physically. And I'm sure you can look at someone and tell when they're stressed. They're furrowing their brow, they're clenching their jaw, their shoulders are up around their ears. They don't know they're even doing that. That's just a sort of natural response that we do. If we can just work on people's tight spots, relax them, get them to relax their face, don't clench your jaw, don't hold your shoulders up around your ears, it can reduce stress, and stress, anything that's going to reduce your stress is just going to make you feel better mentally. And just one quick little story. I had a client years ago who came to see me, and specifically she wanted a male therapist. It was actually at the suggestion of her psychotherapist. This woman had been abused by male family members when she was a child, and the therapist suggested, why don't you go for a massage with a male therapist, find someone you're comfortable with, so that you can be touched by a man, but in a safe place, in a non-threatening, non-damaging, non-harmful way. And she was kind enough to tell me all of this before we started. Okay. And she gave me the warning. She says, if I have to stop, or if I start to cry, it's nothing that you've done, but if we have to stop, I'll tell you. And we never did. She was good with it. I brought her in. I talked her through everything. I made sure that she knew that where I work, she was in a safe place. And this is true for every patient. Whether you come see me or any other massage therapist, you are always the person in charge. If you don't like what you're receiving, you say stop. If you don't like the pressure, tell them to lighten up. People always say, oh, well, you're the expert. You know what to do. It's like, well, yes and no. I know what I'm doing, but I don't know what you're feeling. Okay, so I need you to communicate back to me what you feel. So anyway, with regards to this woman, it was a very positive experience. Actually, for both of us, it made me feel good that she trusted me, and she felt better and comfortable. And we did have an ongoing client-patient relationship for a while until she moved away. So it was a very positive experience. I would hope for both of us.
Yeah, and what is the ratio of male versus female massage therapists? Because some people might not be very comfortable because of cultural reasons, religious reasons, whatnot. They might not be very comfortable to have someone from the opposite sex doing massage for them.
Yeah, this has been something that has been an issue for me for my entire career. And you touched on something that's very true. You have to be respectful of a person's cultural differences, their religious beliefs. And if they don't want a male therapist, it's not a personal thing. That's just something that they're not comfortable with. Yeah. I would never want someone to come to see me for massage if they're not going to be comfortable. The ratio, there's a lot more female therapists than there are male therapists. And I would say even client-wise, I'd probably say it's probably about a 60-40 ratio of female clients to male clients that I see.
Okay.
It is funny because quite a few of my male clients are the husbands of my female clients who will eventually say, oh, go see David, go for a massage. He's a nice guy. And I find it humorous that men will say, oh, yeah, he's a guy. I don't want to go get a massage from a guy. It's like, well, what do they think I'm going to do with him, first of all? And finally they'll come in and they'll give me a chance. And I ask them this, and again, I hope I'm not going to be too crude, but I say, you're hesitant to have a massage with me because I'm a man. Like, why is that? Well, it's kind of weird because you're a guy, and also a little bit of homophobia there. And I say, so you have a problem with a man touching your back. If you had to go to the doctor for a prostate exam, would you rather a male doctor or a female doctor? And they always, I'd definitely a male doctor. It's like, well, you would just think from anatomically, women tend to have smaller hands. Wouldn't you just, from that point alone, prefer a female doctor? But how is it that you're okay with a man digitally inspecting you, but you don't want a man to touch your back? It just doesn't make sense to me. But again, I have to respect how people feel. I don't have to like it. I just have to respect how people feel.
So for most men, it's okay for them to have a male doctor probe them than a female one.
They'll do that, but they're hesitant to have a female doctor. And so again, just finger size alone, I think I would prefer a female doctor.
Because I think again, like we said earlier, there's this gray area or fine line between erotic massage and the real therapy, because of this reputation, unfortunately, like this misconception some people have. So that's why they wouldn't have like someone from the same gender. And here comes question here, what is the ratio or what is the percentage of people who would prefer to have someone from the same gender do massage for them?
Well, I think it's much higher with women, and it's much higher with I can, again, my experience is my clinic is located in an area where we have a lot of new Canadians. A lot of them are Middle Eastern, a lot of them are Muslim. And as a result, they are more comfortable with female therapists. They come in, I'll greet them at the door when they walk in to get information, and they'll always ask me, do you have a female therapist? And I say, well, I do. I have female physiotherapy assistants. I have a female physiotherapist. I have access to a female osteopath, but right now I'm the only massage therapist here. And very often they won't come back, and I get it. I understand. Believe me, I would like nothing more than to actually hire a female massage therapist, but truth be told, I've been having a lot of trouble. I've hired 2 ladies to work for me in the last couple of years, and they've both had good technique, but their work ethic has just not worked well with the clinic.
Okay. And how about men? Like, do they usually prefer to have a masseur or masseuse do their like?
I still think men would probably lean more to women. I just think they're more comfortable. It's the idea of being touched by another person. They would rather it be a female than a male.
Okay.
And again, some of the times I forget. I've been doing this for so long that, like I said, massage to me, I might as well be out building a deck. That's about how sexual it is to me. But people are allowing me into their personal space, and I am very often touching clients in places that, other than their intimate partner, no one else is touching them. Like if I'm working on someone's like legs or hips, I'm touching them. No one goes up and touches you around your hip, and no one goes up and touches you on your inner thigh other than your intimate partner. And I guess sometimes I forget, because it's not in any way, shape, or form intimate to me. So I sometimes have to step back and realize that just because it means nothing to me comfort-wise doesn't mean that it's not going to be uncomfortable for other people.
Yeah, of course, definitely. Well, I really have to thank you very much, David, for being with us tonight, and I think, like all our listeners and viewers, really enjoyed having you with us tonight. Like a lot of very, very useful information.
I hope so.
Yeah, absolutely. And is there any kind of final advice you want to give to our listeners and viewers regarding massage or physiotherapy?
As you're getting older, when you're young, you can hurt yourself and you think, I'll leave it alone, I'll be better in a couple days. After a while, that just doesn't happen. You're far better off when you start having a problem. Don't wait 3-4 days. Go right away. Either go to your doctor, go to your clinic, your trusted clinic, someone that you've worked with before. So go to your guy or your girl, and take care of the problems early, because especially as we age, things just don't heal as quickly as they used to. And something as simple as a half-hour massage can mean the difference between your back hurting for 5 days or maybe a day and a half. If you can cut it short, do so. Do it for yourself, and do it for me.
Definitely. Well, thank you, David Oldnall. Thank you very much for being with us tonight. And thank you very much, dear listeners and viewers. We wish you a lot of health and prosperity. Thank you very much for joining us tonight. Until we meet again, have all the best and have a good night.
Thank you.